You all must be familiar with the term called Achilles heel, and we might have had pain around the Achilles tendon. And many times it gets resolved by its own, but many times it doesn't, and over the period of time it gets severe and severe. Hi, I'm Dr. Prithviraj Deshmukh, Orthopaedic Surgeon, Orthobiologic expert, and pain management specialist at Nexus Day Surgery Center. Today, we are going to discuss what to do when you have chronic persistent heel pain. So, the problem of Achilles tendonitis mainly occurs in the women who are habitual of wearing high heels and also in the sports person who require regular repetitive physical activity. In short, Achilles tendonitis can happen to any one of us. So understanding it is quite important. So here you can see it's an animated image of ankle. Over here this is the bones and this is the Achilles tendon. You can oversee the problem lies around this region. Because of the repetitive movement around this tendocalcaneal junction, usually the bursa around it gets inflamed. And once the bursa is inflamed, that is the point when you all will start having the pain around your Achilles tendon. Initially, we all try to ignore the thing or even try to give a bed rest and restrict our mobility. But eventually, if the pain is persistent, we all should visit an orthopedic surgeon. So once you visit an orthopedic surgeon, the next step he's going to do after the examination is an order an X-ray for you. So sometimes if the problem is very severe, the X-ray might look something like this. So this is the bone, as the tendon is not visible on the X-ray, but over here around the tendocalcaneal junction you might find some calcification, and that is a red flag sign. Usually if there is a calcium formation around the tendon, that is the point when the problem is going to be persistent and it is going to stay with you. I do understand that nobody of us wants to undergo for the surgery, and even I believe that surgery should always be the last option rather than being the first option. So if you come to me, I would thoroughly examine your ankle, and after examining your X-ray, we would come to a conclusion that you might require an ACP injection at the level of the tendinosis. With the help of ultrasound, we will be examining the bony tendocalcaneal junction, which I had shown you just moments back how it looks, and with the help of ultrasound I will identify the spot, and with the help of ACP double syringe system we might require multiple quantities of it. We will inject it exactly over the most weak and the most painful part of your Achilles tendon, and mark my words, you might get pretty much better relief after 15 to 20 days, and you might even start living your normal life the way as you used to be.